as you look at the workforce shortages and how that's, impacted patient care and operational efficiency, what does that look like for your organization? What does that look like for you today, and what has that been?
Sure. Well, I would tell you that we are in an enviable position here in that we aren't experiencing some of the same shortages as probably other parts of the country are, and whether it's rural or even other metropolitan areas. As I mentioned earlier, we have currently less than 5 travelers, and the only reason we have those 5 is because the flu season kind of snuck up on us, was a little bit more severe than we anticipated, and so we had to bring in about 5 med-surg nurses. But fortunately, we aren't having some of the same challenges. We are able to, I think, fill a lot of our gaps with per diems, and our per diem. We're able to attract per diems from around the entire Bay Area because, nurses, PCPs, whatever, can come and work for us, as well as have their foot in the door at other organizations. And there's a premium around doing that. And I think if the caregiver has other benefits, they don't have to worry about benefits. So, so that, I think, is a lot of where we're unique, just because of our geographics and our, in our area where we are. So I'm thinking Keith has probably got some different challenges, but that's what we're seeing here.
Well, I would piggyback on what something John said earlier about there's not a silver bullet. It's a multi-pronged approach that you have to take, and having vendor partners, and truly partners that are workforce solutions experts that are have a view across the country, like AMN, where as an independent healthcare system here in Norman, we don't have the benefit of 50 sister hospitals or a big system, corporate offices to pull from. We're kind of it. And when I arrived a little over 2 years ago, we had over 120 travelers here. We had never had travelers before the pandemic. We had over 100 short-term agreements that we were using as well. And the key, I would say, probably a couple of things on this topic would be, truly addressing having an MSP, vendor management service program, that is aligned with your goal of eliminating, travelers or utilizing them minimally. And we were able to, in partnering with Brittany McGill, our CNO, COO, and I think that's a key, being aligned with your clinical leaders, your nursing, leaders, that they're engaged in this effort. And by having a weekly call every week without fail, to go through every traveler we have here when they're coming off of their assignment. Can we convert them? If you like them and they like you, take them to lunch, love on them, recruit them. And, with our partner, we were able to hire them at no out-of-pocket expense. So we could bring them on, and we were very successful with that. In a year's time, we've now been managing under 10 travelers that we have here ongoing. So we eliminated a little over $10 million from the expense line there, and we eliminated all of our short-term agreements. And I'd say the last piece of that was the pipeline programs are just critical for a system for us, and that's working with the universities and the technology schools, partnering with them on LPN programs. We run an ambulance service here as well. So we, for EMTs and paramedics, RNs, we, really, again, embrace that notion that there's not one single solution. You've got to really, pick your priorities and leverage them, and focus in on them. And the great thing about being an independent too is if we try something and it's not working, we pivot and let's do something else. But, we have the ability to, move pretty quickly.